Hi Sheridan, it's Mayor Tara Beiter-Fluhr. There's so much going on with COVID right now, and I wanted to give you an update. Sheridan Rising Together for Equity kindly offered to provide a Spanish interpretation, so thank you to them. And I'll try to stick to my script so it's easier for them. I receive weekly updates on COVID in Arapahoe County from Dr. Douglas, who's the Executive Director of Tri-County Health. And I also got an update from Casey Wolf at the Colorado Department of Health and Environment on Friday. So I have a lot of up-to-date information from both of those sources to share with you. Some of their data is at the state level, some at the county level, and some at the city level. Like I said, it's a lot of information. I hope you'll find it interesting and hang on until the end, because I'd like to ask you all for your thoughts too. So on the first screen here, you see information from CDPHE, their most recent briefing to cities just yesterday. As you can see, the 3-day average of new cases they show here for the state is 4,725, and there were 6,499 new cases just on Friday. That's the highest ever. They said that we're in an uncontrolled exponential growth phase. The hospitalizations have surpassed April and May levels. There are no signs of flattening, so all metrics are expected to climb. 48 counties in Colorado are in what they call the red level, and Arapahoe's already been in the red level for 2 weeks now. Infections are highest at the state among 20 to 39-year-olds, then 40 to 64-year-olds, and then 65 plus. Hospitalizations are on a steep upward slope among 40 to 64-year-olds and 65 plus, and those rates are basically the same between those two age groups. The state does modeling, and their models right now show that we should expect we would lose 8,500 people in Colorado by the end of the year if we stay on the current trajectory, and if people keep with the same amount of social distancing as they're doing right now. Let's dig into some Arapahoe County data and some Sheridan data now. So for Arapahoe County, the trend is very similar that we saw for the state. The new cases are increasing at a very fast pace, and I added the case count numbers at previous 2 peaks so you can see how many more cases are being added every day than there were in the past. Next, let's look at Sheridan. So on the bottom left graph, you can see Sheridan's trend is similar to the state and Arapahoe County. The most recent reported daily cases was 9 on November 11th, and the PQC was 10 on November 9th. We've had 220 total cases and 4 deaths. If you look at the weekly incidence rates in that bottom right graph, the most recent is 527. The state's levels would say that rates over 350 should be in a stay-at-home status, but the state has not issued a stay-at-home order yet. Here are some more Sheridan statistics. I think the city rates shown at the top right are interesting to compare with other metro cities. Our crude rate, which means the total COVID cases per 100,000, is higher than our neighbor Englewood, but quite a bit lower than some of the other cities with similar demographics to us, like Federal Heights. The graph on the bottom right might be surprising to you. It was a little surprising to me since much of the media focuses on COVID impacting older people. But if you think it through, I think it reflects that Sheridan is home to a lot of essential workers, people who are in those working ages of 18 to 64, and unfortunately have more opportunity to be exposed than our elders do. I also wanted to share with you this graph showing the ethnic makeup of people with COVID. As you know, we have a large Hispanic population in Sheridan, so it is disturbing to me that people of Hispanic heritage in Arapahoe County are very disproportionately impacted by COVID, as shown in this graph. Next, I wanted to share some data on hospitalizations. Obviously, one of our primary concerns is whether we'll have enough hospital beds for people who get COVID and need to be in the hospital. The top graph shows total hospitalizations in Arapahoe County right now for COVID. And you can see the trend in increasing hospitalizations to where we're almost at the same point as back in April and May. At the bottom there, it shows that ICU capacity is down to 8.6% in Arapahoe County. These two graphs show that hospitalizations are trending upward. When we look at making policies around COVID, we want to understand where people are getting exposed. So this graph shows common places where people might be exposed to COVID in Arapahoe County. These are based on actual cases and contact tracing. So you see there's small private gatherings as the main source of infection, then restaurants and cafes, large private gatherings, office work, church and religious gatherings, and then large public gatherings. For Sheridan, some of these are similar. The exposures could have taken place at small private gatherings, church and religious gatherings, large public gatherings, restaurants and cafes, and bars and clubs. So let's touch on what the current restrictions are. Arapahoe County is in the orange level on the state's dial. This means that critical businesses are still open. Non-critical businesses are open with restrictions, which are usually a set number of people or 25% of their capacity. And right now, Tri-County Health recommends for all of these that you stay at home as much as possible, practice good hygiene, wash hands frequently, and don't touch your face. Wear a face covering or mask when you leave your home, and connect with neighbors and loved ones virtually. I think we all know that holiday travel and get-togethers are going to be a major risk. So please don't let your guard down, even when it's with extended family. Keep on the mask. I know it's awkward with family, but keep in mind that the more interactions with people who don't live with you, the more risk you're taking. So I would ask you to please meet with people virtually whenever possible and reduce in-person contacts in any way you can. Interact only with your own household. And just one other thing to keep in mind is that CDPHE says they believe it's about 20 times more dangerous to be indoors versus outdoors. And I know it's hard to have an outdoor gathering in the season we're in now, but whenever possible, if we have nice weather, try to gather outdoors or just try to have your house more ventilated to reduce that risk. Another tool that we can use to try to reduce exposures is the Colorado Exposure Notifications app. You can see I've given you the links there. It's addyourphone.com and addyourphone.com Espanol. You can find it in the Apple Store, on the Google Play Store under Colorado Exposure Notifications. So with as many cases as we have daily right now, contact tracing is just not possible. There are too many cases. The state can only trace about 1,200 cases a day. And as we said, we had 6,400 cases on Friday. They prioritize doing contact tracing for outbreaks, which means 2 or more people at a single place, like a store, have an active case. That's an outbreak. So this app is one way that we can help to reduce the case counts. The app does not store any personal information. It only shares an anonymous token with other phones that are in your area for an extended period of time. So when someone updates the app to show that they have COVID, you'll get a notification that you were exposed. CDPHE mentions that they think if just 15% of people use this app, the infections will be reduced by 8%. So if you think about Friday's rate of 6,400 cases, that would be about 520 fewer people, fewer cases a day that would be exposed. And 1 million phones in Colorado have already activated the app, so it is being taken up pretty broadly. So I really recommend it. I have downloaded it myself and activated it. So thank you for hanging in through all these slides and all this data. I hope it's been helpful. I really would like to hear from you as well. I know everybody's situation is different, and I think it's hard for us sometimes to put ourselves in other people's shoes when we think about what the response to COVID should be. So what would be really helpful is if you could share your personal experiences during COVID with me so that I can best represent Sheridan. I put my email on this screen. That's the best way, especially if you need assistance in Spanish, because I won't be able to answer you on the phone. Tell me about what was your personal experience during the previous stay-at-home order. What do you think your experience would be if there were a new stay-at-home order, if you think it would be different than before? Do you believe we should continue with the current restrictions or that additional or fewer restrictions should be in place? And where have you personally seen people engaging in risky behavior during COVID? Do you believe there are steps that we could take to reduce those risks? And do you have any other suggestions for the public health authorities and for me and other elected officials based on your personal experience for what we could do to stem this rising wave of cases? So again, the things I'm asking you to take action on, please download the app, follow the safety precautions, and the third request is to help me know what the right path forward for Sheridan is by sharing your personal experiences so that I can have an informed opinion to share with public health officials. Finally, we know a lot of people have been impacted negatively by COVID, so I wanted to share resources with you again. Sharing with Sheridan Food Pantry, Thursday evenings at Sheridan Rec Center, Sheridan Rising Together for Equity Food Bank, Mondays at Valley View Church, and you can look for them on Facebook. Interfaith Community Services, Integrated Family Community Services. They have multiple weekly opportunities for food assistance, and they may be also able to help you with utility bills and referral to other resources. The city's webpage has a resource list for housing help, food help, and business resources that you can see from the home page. Click on COVID-19 resources quick links. And businesses can also contact Tri-County's Business Reopening Task Force. I've provided the number and an email address there. Again, thank you for hanging in there, and I appreciate your interest in what you can do to help get through this pandemic. I hope the slides have been interesting and informative. I appreciate all of you in Sheridan, and I wish you and your families all the best for health and joy during the upcoming holidays. Again, please reach out to me if I can help you with anything. Bye.